Robert Laszewski, Unscrambling Healthcare, Interpreting Change. I have known no one with a better grasp of what's going on in Washington than Bob Laszewski, and no one who is more fair, honest, and less partisan. Dr. C. Everett Koop.
We as a healthcare system are at the very beginning of an evolution toward being effective, toward being able to collect and use data to improve both the cost and quality of our system.
Robert Laszewski, informed, impartial, in demand.
If I were a consumer, I would be very concerned about having a conversation with my physician, understanding how that physician is compensated.
If he can't make it work for him, if he can't put and keep Bush on the defensive on health care, I don't think he can win this election.
I don't think we're going to get a patient rights bill next year because it doesn't seem to be that either Democrats or Republicans really want to do it.
Robert Laszewski, Unscrambling Healthcare, Interpreting Change, examining health policy of the healthcare marketplace for more than 30 years. Robert Laszewski, often called upon to present his impartial opinion before the United States Congress, sought after by the media for his unbiased expertise, chosen by NBC's Truth Squad for his objectivity during the 2000 presidential campaign.
That is false. Governor Bush's prescription drug plan provides a 25% subsidy for all seniors.
Robert Laszewski, speaking to a broad range of organizations, pharmaceutical companies, hospital and provider associations, insurance groups, employers. President of Health Policy and Strategy Associates, Robert Laszewski is also National Health Policy Advisor to the insurance practice of Ernst & Young.
Most HMOs never really changed the game. Most products, even today, are still fee-for-service, layered over deep discounts and tough medical management on top of better expense ratios. Fundamentally, we still have a fee-for-service system in most, not all, but most markets of the country. This is what we call in Washington the law of unintended consequences. They didn't intend to do this to you, but they did. Now the question is, what do you do about it? Maybe the most important thing I can say to you today is that during the month of August, when these members of Congress are home on the summer break, you need to get to them, you need to get them in your office, and you need to beat the hell out of them. People in Washington do not believe this is happening. There's a cynicism in Washington amongst staffers, amongst many members of Congress, and maybe not amongst yours because you've already got to them. But I will tell you there is not a sense that this is a serious, serious problem. In the end, I think what it comes down to is being systematic, is taking all of the information that you've got, assembling it in a way that makes you the most productive and effective provider of health care in your market. That isn't necessarily going to overcome the political problems. That's a different challenge.
What's the percentage of geezers in the United States, senior power?
Oh, I think it must be up around 18%.
Oh, I think it's closer to 25%.
Well, we know that 25% of the people that are going to vote in the next election will be seniors, and that's the geezer power you're talking about.
And there are 41 million people on Medicare.
What's the answer to my question? What's the driving force behind this? The year 2004? The upcoming election? The recognition on the part of both parties that they have to do this, particularly the Republicans, since they control the House, the Senate, and the White House?
This president promised in the last election that there would be a prescription drug plan. He's got to go back and run for re-election in places like Florida, where the vote was close, and there are lots of seniors, and he's going to have to keep that promise. That's the driving political force. But I don't think, even with that driving force, I think it's going to be still very difficult to get a prescription drug plan this year.
Why do you say that?
Because there are fundamental differences between the Democrats and the Republicans on this issue, differences that will be very difficult to resolve. And it comes down to whether you continue the Medicare entitlement, the Democratic Medicare entitlement that's been around for 38 years, or you fundamentally change how you pay for Medicare. Conservatives are saying we do not want to spend another $400 billion on entitlements, especially facing $400 or $500 billion deficits, unless we reform Medicare. There's a fundamental difference here.
Are we talking between Republicans and Democrats or between the Senate and the House?
You're talking about differences between the Senate and the House, but largely the difference is conservative Republicans versus liberal Democrats. Liberal Democrats have leverage in the Senate, where it takes 60 votes to pass anything. Conservatives have the leverage in the House.
Tony, there isn't much less for you to say on the subject,
Let me go back to your original question. First of all, between 75 and 80% of the public, not just geezers, are in favor of this. The prescription drugs become a higher percentage of medical costs because prescription drugs deliver so much curative power more now than they did 30 years ago. So it's a bigger piece of the cost. It's equivalent very often for people of their 30-year mortgage payment. They finish paying their mortgage and they're going to pay that much more in prescription drugs. Not only did Bush promise it during the campaign, the House Republicans last year passed their version. The Senate Democrats failed to. So this is a big opportunity to fulfill a promise, and I think it's a piece of a possible perfect storm for the Republicans. If they can pass this, along with tax cuts, assuming the economy gets back and Iraq doesn't go bad, they have a chance for a very powerful election.
What does the president mean when he says, give me a bill I can sign?
What the president means, what comes down is what he will sign.
I'll sign anything.
Look, but this is the problem.
Right?
Let me talk about that. Bob's right.
That is
Wait a minute, let him finish.
But that's not
Bob's
true.
right that there are Republicans, John, who will not go along with this in the House unless they can basically have the privatization side of this thing. And if the president can't get them, he's got to cut a deal with the Democrats. He's got to overrun his Republican base. It'll be good for the president politically. He will sign it, but he will antagonize, deeply antagonize.
What do you think? Who gets the bigger plus?
I think that what's being missed here is the senior vote. I think that when Congress in August goes back for the recess, goes to the county fair, they're going to hear from seniors that, believe it or not, they're not happy with this benefit. This is $400 billion being spent on $1.8 trillion. Only about 22% of drug costs being spent over the next 10 years are going to be covered. 60 to 70% of seniors already have drug plans that are better than this. I've got a feeling that when members come back, they're going to say, wait a minute, I'm here to compromise my principles, conservative or liberal principles, and something that seniors are going to be upset about. I think that this may be a loser overall as seniors read the details.
That's bipartisan. I mean, if you're from a rural state, you're likely to find rural friends across the aisle who are friendlier to your way of looking at this.
It's bipartisan, particularly in the Senate, but that's not so much the case in the House. It's interesting, in the Senate, we have a bipartisan agreement. 40 Republicans voted for it, 35 Democrats, and 1 independent. In other words, you don't have either a Democratic or a Republican bill. You're going to need both Democrats and Republicans to be on that Senate bill in the long run. In the House, you've got a much more partisan situation. It really is a Republican bill. 19 Republicans voted against it, by the way, but it is largely a Republican bill. And what's fundamentally going on here is there are many Republicans who feel very strongly ideologically about this, that you just can't add another $400 billion entitlement program to a Medicare plan, especially as the baby boomers retire, that's just plain out of control. We've got to do something about that. And they believe you've got to move toward the private sector. Just as much as many Democrats, not all certainly, feel that the way that this has got to be taken care of is a government plan that can contain costs. Both sides have really drawn a line in the sand here. The problem is these lines are a mile apart. And it's not like one side believes you should spend $350 billion, the other side says $450, so we split it at $400. These are deep-seated ideological differences that I don't know how you split.
But Bob Reischauer, after this bill passed in the House and the Senate, the president put his sizable shoulder behind it, and it looked like things were steaming along. What happened between then and the day that this conferees began their work?
Well, people looked at the detail, and the devil is always in the detail when it comes to health legislation. And these are very complex bills, and the ramifications of various sort of innocent-looking provisions are suddenly analyzed by all the interest groups and the political actors in Washington, and people then begin to draw back. At that point, the Democratic senators in the Senate sent a letter to the president saying, these are our minimum demands: no premium support, no means testing, no tax advantage savings accounts for health, which the House had put into the bill and the Senate hadn't considered at all. And then the House shot back with a letter from the Republicans to the president saying, well, here are our lines in the sand, and we have to have a competitive system, even though there's precious little evidence that a competitive system is going to save money. It could in theory, but in practice we haven't seen that. And we have to have the tax advantage savings accounts and so on and on. And as Bob said, these are two lines that are miles apart right now. But we have months to go, and we'll probably see pictures of the conferees meeting day after day, week after week.
Does the 2004 election cycle play into this, and how so?
Absolutely. I mean, both President Bush and then Vice President Gore said we needed a prescription drug plan. They both went to states like Florida and said, we will pass a drug plan. The president has promised that seniors should have a plan. He's going to have to go back to Florida to campaign for re-election. As many as 25% of the voters in the next election will be seniors, and they have wanted a drug plan. But I'll tell you another dimension of this that's interesting is as seniors are beginning to look at this, somewhere between 60 and 70% of all seniors have a drug plan today. And a lot of them are taking a look at the benefits that are being provided here. And many of them have drug benefits that are better than what they would get, particularly in employer-provided plans. And there's a concern that if we pass a drug plan, many employers could drop the plan. The CBO has estimated about a third of all employers would drop their drug plans if this passes. So I think as seniors are looking at the details, they're sort of wondering, am I better off or am I not better off? We're also seeing many of the conservative grassroots groups really getting behind these House Republicans. And while one would expect Republicans would get in line behind the president and pass a plan, there's a lot to indicate that conservative Republican grassroots groups are telling the members to hold that line.
Does that reality make this conversation a whole lot harder?
Well, it certainly solidifies a position that many of the conservative Republicans are taking, that we just can't add another entitlement without thinking this thing through. I agree with Bob. If there's going to be a compromise, it will look more like the Senate version. But I'll tell you, in order for that Senate bipartisan version to get through, somebody's going to have to cave on their ideological foundation.